listening to the Pharmacy Podcast Network.
This is Pharmacy Crossroads with your host, community pharmacy business veteran, the road trip guy, Bruce Nealand. Community pharmacy is at a crossroads. Pharmacy owners across the country are evolving their pharmacy businesses and making a bigger impact on their communities. Bruce talks with the most innovative community pharmacy owners, pharmacy industry experts, and people who are passionate about the business of pharmacy and its impact on community healthcare. Pharmacy Crossroads is a member of the Pharmacy Podcast Network. And now, here's our host, Bruce Nealand.
Well, hello, everybody. This is Bruce Nealand, and I get to be the host of Pharmacy Crossroads. As always, I'm excited by the people who I get to speak with and introduce you to on my program, and today is no exception. Today, I have John Beckner. John Beckner is a pharmacist, and John, I'm thinking you're old enough that you're not a PharmD, you're an RPH. Is that correct?
I'm an RP. I'm one of the veterans.
Well, you're one of the best at that as well. John is the Senior Director of Strategic Initiatives for the National Community Pharmacists Association. John and I have been friends. I've been trying to figure that out, but we must have met at a trade show or meeting early in the 2000s. So we've been associated with each other for 20 years at any rate. And you've managed to move up from a chain drug position and take a spot with the National Community Pharmacist Association. And that's allowed us to talk even more frequently. Hey, so John, as we talked before when we decided we wanted to do this podcast, the topic that was foremost on your mind was pharmacist immunizations, the opportunity that exists for them, the absolute public health need for it. So first of all, before we get into that, tell me just a little bit about your background and what you do for NCPA. And then we'll start talking all things immunization, and I think we'll even get into point of care testing and other opportunities that pharmacists have today. But who are you? And then tell us what immunizations can do for pharmacists and the public.
Well, Bruce, first of all, I really appreciate you inviting me to be on your podcast. You're absolutely right. We've known each other for a number of years, and I consider you a close industry friend. So I'm looking forward to our conversation this morning. Prior to joining NCPA, most of my background was in chain operations management. I ran the pharmacies for a couple of small chains, one of which was very progressive in the area of immunizations, and that was Ucrop's supermarkets. And I was with them for, I guess, a little over 17 years, and we were actually one of the first pharmacies in the country to offer immunizations back in the late 1990s. So my work in that space goes back a number of years. And when I came on board at NCPA, I think that really immunizations became a big area of focus. And right now, our goal is to make immunizations a core competency of independent community pharmacy. I work in the strategic initiatives area, which is the area that helps our members offer diversified services, one of which is immunizations. Although immunizations, pretty much everybody is doing immunizations these days. So if you're not doing it, you're really behind the eight ball. Also work with our education team and our advocacy team. So I'm having a good time at NCPA. It's a great organization and great people. And, I really find it very rewarding trying to help our members.
Here's a message from today's episode sponsor.
At RxSafe, we believe in improving patient health by challenging conventional wisdom, upending the status quo, and transforming the retail pharmacy industry. Our innovative technology solutions are designed to accelerate your pharmacy's success and change the way you do business. We develop long-term partnerships with pharmacies and other industry innovators to help attract new customers, create additional revenue streams, and transform the traditional pharmacy model. Become the adherence packaging leader in your community and practice at the top of your pharmacy license. Get started today. Visit rxsafe.com. That's rxsafe.com to learn more.
So immunizations, I get to claim a little bit of industry leadership on that as well. We don't need to go into that, but I was helping pharmacists doing it with Amerisource when I was there in 1999. We got started and had some training at our annual meeting. And it just always struck me as the easiest, best, most logical way for a pharmacy to learn how to create demand rather than just stand behind the counter and accept what comes into them. And that notion of creating demand is a fascinating pivot point for the practice of pharmacy that's even more important today than it ever was, than it ever has been. But tell me everybody knows about flu and everybody knows about COVID, but I'm not sure most pharmacists have digested some of the other very popular and common ones. So, tell us a little bit about what can be done, what you're seeing done at the cutting edge for immunizations, and how pharmacists are getting physicians and patients to learn to come to them for these services.
Well, Bruce, I think one of the maybe the silver linings of COVID was that, pharmacist work in the immunization space was really showcased. I think a lot of people were already used to coming to the pharmacy to get immunized, and obviously flu and pneumonia are two of the more common diseases that folks came in to be immunized for. But I think COVID really served to showcase, what pharmacists are able to do with regard to immunizations. Also, pharmacists, they're working very closely with their local health department to provide this service. Really, again, was showcased during COVID, and hopefully this is going to continue well beyond the pandemic. I think from a public health standpoint, pharmacists provide very valuable services, whether it's providing COVID vaccines, flu vaccines, pneumococcal, and the other routine vaccinations that have, in some cases, really lapsed during the pandemic. So this is a huge opportunity for pharmacists to continue to advocate for their patients to get vaccinated against preventable diseases.
I am surprised at the number of pharmacies. When I'm out and about, I'll stop in at a pharmacy completely unannounced and just kind of walk in and see if I can chat with the pharmacist. And, about half the time I'll find an opportunity to visit. But I'm still amazed at the number of pharmacists who do not aggressively do flu shots, and that's the typical place to start. What do you think the hurdles are?
There are a number of hurdles. I guess the good thing is it's the percentage has grown steadily over the last, 5 years. So now, our surveys, and we survey our members on a pretty regular basis, and we have something called the NCPA Digest, which, that's provides statistics about a number of things. And one of those is, what types of clinical services does your pharmacy provide? And the latest survey indicates that roughly 80% of our members, or the people responding to the survey, provide at least vaccinations against influenza.
Right.
Now, there's a couple of ways to do that. They could be providing immunization or vaccinations, but are they really being proactive in terms of, if somebody comes into the pharmacy, is the technician in the pharmacy, or are they really probing to find out if that person is in need of, not only a flu vaccine, but there are other vaccines. And I think, surveys have shown that the average person coming into the pharmacy, they're probably 2 to 3 vaccines that they are in need of, and it certainly provides an opportunity for the pharmacy to take care of that patient, but also it's certainly a revenue stream for the pharmacy.
Well, and I didn't clarify with you whether you were prepared to talk a little bit about revenue streams. I mean, do you have a handle on what the current fees are for flu or any other? I mean, I know they've changed some stuff with COVID here recently. Are you up to speed on that?
Well, I think with regard to flu, I think it really depends, because most of the insurance plans are paying for flu, but their reimbursement levels vary by plan. Now, Medicare, I think it's the current Medicare fee for influenza is in the $30 range in terms of what they are reimbursing. So it's going to vary by commercial plan, and one of the backing up for just a minute in terms of what you asked me, why aren't more people providing immunizations? They may have some concerns about how to bill for these vaccines. Billing and reimbursement tend to present some barriers for folks. And, one of the things, I'll mention this, one of the things that we produced last year was a vaccine billing guide that really takes you from A to Z with regard to billing. A lot of vaccines are covered under the medical benefit now, so there's some information in there about that. There's information in there about how to, if you're filling a vaccine for a particular plan, it walks you through how to add the administration fee, and so you'll be reimbursed for not only the product but also for the administration fee. So, and again, if you haven't done it before, you may be intimidated by trying to figure out, what does the billing piece look like? And this guide really is helpful with regard to that.
So it's the vaccine billing guide, and I'm assuming that if they go to ncpa.org and look for the library or whatever it is, they can figure out how to get a copy.
Yeah, it's on our website under resources.
Under resources. That's probably the most valuable thing that we can share with people this morning who aren't yet doing it. So vaccines lead us to the topic of health prevention. And I know you had indicated a desire to talk a little bit about point of care testing and, the way a pharmacist can enhance his position in the community and his economic benefit through point of care testing. What are 2 or 3 of the most commons of those, and how do you get a CLIA waiver?
Well, that's another bit of information that's also available on our website under COVID resources. One of the things that we found out during COVID was that point of care testing was really another opportunity for pharmacists. Once they were granted an authorization, emergency use authorization during the pandemic, pharmacists could provide testing. But the first thing they needed to do to be able to offer that service was to get a CLIA waiver. Yeah, and stands for Clinical Laboratory Improvement Act, and you had to do that first before you were able to offer one of these tests, which were CLIA waived, whether it's a COVID test or some people already had a CLIA waiver and they were already doing flu and strep. So I think when you look at those 3, flu, strep, and COVID, those are the point of care tests that tend to rise to the top in terms of the most frequently offered in a community pharmacy.
And again, is there a reimbursement mechanism for doing a strep test or a flu test? My understanding that's a cash cash
It's
service?
mostly a cash business. I mean, the pharmacy can set their price based upon what it costs them to purchase the test. So, and that's going to vary across the board, depending upon how efficiently they're able to buy these tests. But right now, it's a cash-based business. I think there is some reimbursement from the plans, but it's not routine across the board. So if you're going to offer that test, it's going to be a cash-based test that you have there in the pharmacy.
And I'm going to do an editorial comment on cash-based tests. Do them. Get used to them, and start learning how to charge people for the services that you provide. The economics on this typically work exceptionally well for the patient, and strep test is I've got 10 grandkids, and so I've got the 4 daughters who are taking care of kids, and they're all working mothers, and they get a phone call from the school or the daycare center and say, hey, your kid's got the sniffles, come pick them up and take them home. They really don't have the time, effort, or energy to try to call and get in to see the doctor, who's not going to see him for 3 days anyway. So, and they're going to have a $25, $40 copay going to see the doctor. So a $25 or $40 charge for doing a strep test in the pharmacy is just an economic wash. But the bigger issue is that it will get you past that psychological hurdle that people won't pay for stuff, and everybody won't, and everybody's not going to fill their prescriptions in your pharmacy, and everybody's not going to vote for the same candidate that you vote for. There's just many people will, and they'll be thrilled that you have the service available.
Well, with regard to point-of-care tests, it really has become a convenience thing in community pharmacy, like immunizations. I mean, it's easy. Most pharmacies offer that service, during the whole operating hours of the pharmacy. If you're in a state that allows for test and treat, you may. I think that's the kind of the pot of gold at the end of the rainbow. You can come in for your flu test. If you're positive, the pharmacist under a collaborative practice agreement or statewide protocol can prescribe Tamiflu, which to be effective has to be taken within 48 hours. So again, It's a timing thing, and it may not be possible for that patient to get in to see their doctor or other provider in a timely fashion for something like Tamiflu to make a difference. So I think looking ahead, there's tremendous opportunities. I've read where, the revenue from point of care testing at some point will exceed that of immunization. So we know how important immunizations have been to pharmacy. I shudder to think where we would be today without immunizations and that service, which really brands or helps to brand the pharmacy as a destination for health and wellness. It's been a tremendous thing for pharmacies to be involved in, and I think it's really cast them in a very favorable light with other providers.
Well, and it serves as a segue to the third point that we wanted to share with our listeners today, of that is to how we can get more pharmacists to be educated, informed, and sharing with their patients information on how to build their immune system and how to kind of take advantage of some of the nutraceutical and immune boosting products that they can recommend and sell.
Yeah, and I think pharmacies or pharmacists have been involved in that arena for a while, some more so than others. Patients trust their pharmacists. They're going to be coming in asking a lot of questions, and from an access standpoint, in terms of how often folks are in community pharmacies as opposed to other places like physicians' offices, they're in a great position to be able to offer some suggestions with regard to nutraceuticals and immune boosters.
Well, and it is a huge opportunity. It's one that requires merchandising, education, those kinds of things. And again, while that has not been customary for pharmacies 15, 20 years ago, it's going to become the basis for how we move forward. And, the line that I take is that as a pharmacist, your job is not simply to dispense medications accurately. Your job is to help improve the health of your patients. And that makes you a healthcare provider. You're a healthcare professional, and your skills and expertise, and quite frankly, your convenience of location and those types of things are assets that you can and should take advantage of. And here's the piece that's also interesting is, too often we talk about profitability of that, but frankly, it's bigger than profitability. It's the health and welfare of your patients. And, the other areas that I see pharmacists getting into are in this whole nutritional field. That's a little bit above and beyond just the nutraceuticals, but, healthy lifestyles and good diets. And that fits in with your diabetes education programs. And the point is there's a whole big circle of healthcare stuff that a good independent community pharmacy sits in the middle of. And there's a world of opportunity. I know that pharmacists can be happy and can be profitable because I see dozens of them every year. So the formula is out there, and you and the folks at NCPA are doing a wonderful job of helping people to see all these opportunities.
Bruce, I appreciate you saying that, and we really do try to cater our educational programs to help our members be able to provide these services. I know the CPSN networks, the CPSN pharmacies, of which there are a little over 3,500, offer these enhanced services, and what we've tried to do, particularly through the Innovation Center, which really is kind of the umbrella organization that houses all of our educational efforts, whether it be a webinar or education at our annual meeting in multiple locations conference. A lot of our educational programs are designed to help our members execute on these clinical programs, to be able to offer clinical services to their patients. So it's really important that in the days of in today's world of declining reimbursements, you really can't depend upon the product anymore. You need to be able to offer these services to patients, which, as you said, will really help them live a healthy lifestyle. It's all about wellness and prevention, in addition to disease management. It really runs the spectrum, and community pharmacists are in a great position to be able to do that.
They are, and that sounds like a great closing comment, John. So we've run out of our allotted time, and I'm going to leave it at that and say thank you. And to my listeners, I encourage you to go to the ncpa.org website, go to the resources section, and look for a couple of these booklets or pamphlets or guidebooks, whatever the right word is, that will help you get into point of care testing and other COVID resources. So for that, I'm going to say, hey, this is Bruce Nealand with another episode of Pharmacy Crossroads, and hoping that something John and I shared with you today will help you do more or be better. Good day.
Thanks for listening to Pharmacy Crossroads. If you're interested in talking with Bruce, please contact the show. Visit pharmacycrossroads.com. We look forward to hearing from you.